then develop COVID-19 educational materials, and then develop and deploy community mobilization and models and strategies. And this is something that is still ongoing. The CoVPN Faith Initiative is very much alive and well, and it's still working. And we're going to have our faith ambassadors, or one of our faith ambassadors, Dr. Ulysses Burley, talk about that more. And we'll hear from some people who have been touched by the CoVPN Faith Initiative. So along with the faith activities that we're conducting throughout the country, we also have other community engagement activities that we've been doing to make sure that we give information to communities that are disproportionately impacted by COVID-19. For Black communities specifically, we have the COVID and Black series, which is a discussion series that we developed in-house to highlight different doctors, nurses, experts who represent the Black community and can speak to as trusted voices to members of the community. We also had and each episode is focused on a different group of experts. So our first group was doctors. Our second group was just Black women. That was our second episode. We talked about ethics and inequality. We had one right before the holidays last year that focused on faith, and we had some of our faith ambassadors on that call. And then we followed up and ended the year with just a diverse panel of experts. And we did this one this episode in collaboration with blackdoctor.org, using their platform to amplify this series. And just as a shameless plug, we actually have our latest episode of COVID and Black today. And so we have a dynamic panel of speakers, as you see here. And this episode is going to be broadcast on the CoVPN Facebook page, and also the blackdoctor.org Facebook and YouTube pages in collaboration with blackdoctor.org. We also utilize social media heavily. We have a whole social media team that promotes our various events and making sure that we reach different populations. So as you see, COVID and Black is listed, but we also had a Muslim focus series called Iman and COVID. We have a Southern Science series focused on, this was done by Dr. Bambi Gaddis in South Carolina. We had a Latinx focus series that is still ongoing, and I think on their 9th episode now. So various activities to make sure that we're leaving no population behind, and as much as we can, no group behind, and that the information is disseminated in ways that are culturally relevant for each particular group. And overwhelmingly, the response has been superb. We've reached, through our events, over 2 million people. We've gotten over 6 million impressions, and the total engagement, so this is actually clicks and things, has been over 100,000. So we have been doing a lot of work, and we've been getting a lot of attention, but as we know that this pandemic isn't over and there's still lots of work to do, but we're very pleased with the reach that we've had so far. And so with that, we want to next talk about the next phase of the HVTN Faith Initiative. And for that, I'm going to turn it over to my good colleague, Ulysses Burley.
Thank you, Louis, and thanks to all of you for attending this important conversation about the intersection of faith and science. I founded my organization, UBtheCURE, from my own experience as a healthcare provider, realizing that we could not meet the full health needs of people in hospitals alone, and that there needed to be more attention given to the social drivers of disease to achieve a more complete wellness for society. As a person of deep faith, my pursuit of that complete wellness, not only for society, but for myself, has largely been informed by the very prominent themes of healing and sanctity of life in Scripture. And so it really was a no-brainer for me to join the work of the COVID-19 Prevention Network Faith Initiative, where I could live out these intersections in my life of both science and faith. And it's an extension of work that I began many years ago with the HIV Vaccine Trials Network. Next slide, please. As a result of my relationship with and mentorship by the Reverend Edwin Sanders. And here you can see Reverend Sanders pictured with Wakefield, who was the previous director of external community engagement and external affairs at the HIV Vaccine Trials Network. And together, these two men are really intentionally committed to doing outreach to faith communities, understanding that the faith community was an important part of the community at large, and that by and large, people's belief systems heavily impacted the decisions that they made about their health and their wellness. And so for the last 7 years, I have been a partner with the HIV Vaccine Trials Network, helping to translate and decipher complex science for everyday faith people, such that they would have the information that they need to make informed decisions about their health. And so now, as a result of our work with the COVID-19 Prevention Network Faith Initiative and its success, we are able to live into a full version of the HVTN Faith Initiative at a time when people have never been more aware about viruses and pandemics and vaccines and clinical trials. And so we're going to leverage our success over the last year of doing outreach to faith communities in educating and raising awareness around biomedicine and vaccines and science to now do so for HIV in its 40th year since the identification. Next slide, please. And so it's my pleasure to be able to direct the next iteration of this work of the HIV Vaccine Trials Network and its faith initiative, which will officially launch appropriately on December 1st, World AIDS Day. Next slide, please. And as you can see, the models are quite similar. And so we believe in not fixing things that aren't broken. The COVID-19 Prevention Network Faith Initiative has been a successful initiative. And so we're going to build on that success with an extended HIV Vaccine Trials Network Faith Initiative that will feature 8 faith ambassadors who represent Christian, Muslim, Baha'i, Buddhist, and Native and Indigenous faiths. Under them, there's a possibility for more than 56 faith consultants. We'll have 2 administrative staff who will do our data analysis and organization to be able to quantify our reach over the next year. And although the focus will be on HIV and AIDS science and how it intersects with faith, we will continue to do the work of COVID-19, understanding that this pandemic will continue to live with us into the future. Perhaps what is not captured here in these slides or these numbers are the actual lives that we've impacted over the last year as a result of this work, the conversations that we've had, many of them being personal. And so for the next part of our session, I'm really thrilled to be able to welcome in some of the folks who've been reached by our work to be able to share their stories, to be able to share where they were at the beginning of the pandemic, how it related to their belief systems, their engagement with us around this work, and then how that engagement possibly shifted them from a place of hesitancy to a place of acceptance as it relates to the COVID-19 vaccine and other associated biomedicines with the COVID-19 pandemic, and hopefully use their experiences as a model for the ways in which we can further bridge this gap between the science and the sacred as communities of faith. Next slide, please. And so at this time, I want to invite in my friend, my colleague, and my brother, Reverend Antonio Red, who is a minister to Christian education, evangelism, and assistant to the senior pastor at Second Baptist Church, West End in Richmond, Virginia. Reverend Red, welcome.
Thank you very much, Ulysses.
Lewis, we can stop our share. Awesome, awesome. How you doing, man?
Doing well, and yourself?
I'm doing fine, man. Thanks for joining us. Thanks for being willing to share really your process over the last year. Tell us a bit more about who you are, what you do, where you're at, and your faith background.
Yeah, so again, my name is Antonio Red, currently in Richmond, Virginia. I was born and raised in Martinsville, Virginia. Southwestern Virginia country boy at heart, and migrated to the city. But I am born and raised Christian Disciples of Christ. That's where I was licensed and ordained. I was licensed and ordained in Christian Church Disciples of Christ. And since being in Richmond, after attending seminary, I, however, have been serving at Second Baptist Church since about 2015, I believe it was. And so been here, my family, wife and 2 children for the last, I want to say, since 2012, been in Richmond since 2012, serving at Second since 15. And yeah, that's the gist of my faith upbringing. I was like many people my age, us closer to 40, we can always talk about being raised in a church where we was at church all the time.
That's right.
And so this last year has been extremely different from being used to being at church, at the building per se, and then going from being there quite frequently to none at all.
Right.
Yeah.
So tell me a bit about when you realized that we were going to be in this situation for the long term, and then when vaccines started to become available almost a year ago, last December. Talk us through kind of the thought process of whether or not you were going to participate in that, whether you were going to advocate for your family to participate in it, and how your faith played a role in that, and maybe even some of the conversations you were having with some of your members.
I actually, it probably wasn't until after, I would say, the vaccination process had already begun before I realized that we would be here long term, like in this virtual aspect. Because the hope was that, once the vaccine became accessible to us, then for, at a local perspective, our hope was once the vaccine became accessible to us that we would, kind of migrate back towards normal. And then, Delta kind of surprised us all and said like, nah, we ain't ready for that. And so I think it was, it was post-vaccination, being instituted and carried out before I realized like we're gonna be here for some time. And even, I think my church, my local congregations, like our apprehension to being in person, face to face on a frequent basis, is weighed in on the backs of many of our parishioners who are medical professionals, and so we're lucky to have people who are accessible to the information and the data and what we need in order to ensure that the people who are coming in the building are safe. And so that's that idea of like, when did I figure out we were going to be a long term? But in regards to the faith and the hesitancy I had in regards to being vaccinated, at first I would say the hesitancy wasn't so much highlighted because I felt like I was going to be like in that latter group. Like I felt like I was going to be in the group that, would have had the opportunity to kind of wait it out. Yeah. And then, and then all of a sudden, like that process was kind of, pushed up a little bit sooner than we had anticipated. And then at the time I was serving as a health specialist for Richmond Public Schools. And so I was included in that group who
you were one of the early groups.
Yeah, the early group. And so like January, I got the email like, Mr. Red, you are, you need to go to the website, you're eligible to get your vaccine. And I'm like, oh man. Like, I'm having that, like, that's that, I guess I don't want to say fear that I felt, but
anxiety,
it was the anxiety, the weight of having to make a decision. Yeah, the weight of having to make that decision was escalated. And so I began to like ask a lot of questions to myself, to people who I was connected to. Thankfully enough, Ulysses was one of those people who I trust, who is not only like my colleague in faith, but I trust him because of his own vocational background, the work that he's done within the HIV community and as a medical professional. And also just being privy to what over the last 18 months or so, I had a close friend who is a member of our congregation, but also the health director of the the Southern Central Virginia region. And he's always, giving us information Sunday after Sunday after Sunday. We've like identified it as the heart moment on Sunday mornings for him to share updates. And so I've had people who I trust as individuals, as friends, as close connections, who I feel wouldn't lead me astray, who I feel would offer me valid information that's not connected to a dollar or is not connected to, some type of influence somewhere else.
Right.
And so, not only was I having conversation with Ulysses, but I was also like, just snoozing around, his Facebook page and seeing all of the events and stuff that he was speaking at, and just listening to his network. And then in the midst of all of that, my mom got COVID.
Oh, wow.
And
I didn't know that.
Yeah. My mom got COVID middle part of January. And what she said to us was, no one is coming home. I think it was like, she was like, at least until Easter at this time. Mm-hmm. And we've already experienced quarantine. We've already experienced like not being able to access like our circles for over a year now. And now my parents have limited like who can access them. Mm-hmm. Because she contracted COVID. My mom didn't go anywhere. Like she still is very, very apprehensive about where she goes. But she contracted it from like a sibling of mine's, like child who came into the home to help. And so she was like, nobody's coming home. And I said to myself then, I said, you know what, if this is going to allow me to be able to have access to my parents, to keep them safe, at the least that I could do at this moment, this is what I was telling myself, the least I can do for them is to get vaccinated, but not knowing at the same time that it was the least that I could do for myself. It was not only what I could do for them, but it was also what I could do for myself. And so, that was my thought process. Like, conversations with close connections, and also that this reality that I was facing, with not being able to see my parents. And so I made that, I took the leap, and, I don't regret it. Like, I share with everybody, like, this is what you could do to not only keep yourself safe, but this is what you can do to keep your circle safe as well.
Yeah, man, I remember being so encouraged receiving your text message. You sent me a picture of you getting your shot and your stickers that said, I got my COVID-19 vaccine. And just to have that accompanying message that said that, listening to me, share information, trusting me, it kind of helped you take that leap. And so I appreciate you for being willing to share just kind of that process that you had. And I look forward to talking about it a little bit more when we open things up for conversation.
No doubt. Appreciate it.
At this time, I'd like to welcome back my colleague, Lewis, who will share a similar experience that he had with his brother and friend, Emmanuel Hunter.
Thank you, Ulysses. That was an excellent conversation, just listening in on you too. So at this time, I would like to invite in my really, really good friend, my brother, and one of the best PKs that I've ever known in my life, Emmanuel Hunter of Morning Star Full Gospel Assembly in Bronx, New York. So, are you there? I don't see you on my screen.
Okay, can you see me now?
I do.
Okay.
Hello,
everybody. Hello, Lewis.
How are you doing today?
I'm doing all right.
All right. So first and foremost, I wanted to ask you, can you share a little bit about your faith background?
Okay. So, like you said, I'm a PK, born and raised in the Christian faith. I come from a strong apostolic background. On both sides of my family, my mother's side and my father's side, they both believe in the apostolic background of Christian faith. Because I was brought up in the church, of course, I took on the Christian faith myself, and I've had this relationship with God for myself. So now it's not just about my family, but now I've incorporated it in my own life. Let's see. In reference to COVID and how my faith plays a part in the whole COVID-19 and the vaccine, I will say that my faith in the community, it did impact me and my decisions on whether or not I wanted to take the vaccine. Of course, my family being so strong-willed, they did not believe in the vaccine. They had their own theories and doing their own little research, they've come up, with reasons on why they shouldn't take it. And I will be honest, it caused me to believe the same things. Some of which it still does. It still does resonate in me because even although I did take the vaccine, there's still parts of me that is a little nervous about the vaccine. Because I've gone with the notion, and we've discussed this, I've gone with the notion that, once the body is introduced to something, naturally the body fights it off on its own. It builds its own immune system. But like Pastor Antonio Reed said, he had to take the vaccine because he was not only thinking about himself, but he was thinking about the people around him. And I realized, like, here in New York, I'm from New York, everybody. I'm from the city. I'm not from the South. Here in New York, there's a lot of restrictions going on unless you have the vaccine. So you couldn't even do anything.
So I just wanted to, I mean, you set this up lovely. And I just wanted to know, people don't, I'm not officially a faith ambassador, but for all those who are listening in, so as part of helping to facilitate the CoVPN Faith Initiative, I kind of took on the work in my own community of also going out in my faith spaces and being an ambassador in my own right. And so that's how me and Emmanuel came into contact or into conversation about everything going on in COVID-19 and COVID-19 vaccines. When I came back home to New York City, we had long conversations. And so do you want to share a little bit about the conversations that we had and what kind of impact those had?
Yes, of course. So a lot of times we would have conversations where you would try to inform me about the vaccine, try to tell me all the benefits of it. And you would often ask me, at the time, because I wasn't vaccinated, you would ask me, how come I wouldn't get vaccinated? And that's when I would share my concerns with you.
Do you want to share some of the concerns you had?
Yeah, no, I wouldn't mind. So some of my concerns were just the way that they went about it all. I'm not against vaccinations. I've been vaccinated before. It's just the turnout was a little off to me, because here in New York, they started out, giving people the freedom to be vaccinated. And then it went from freedom to bribing. And from bribing, it went to, now is becoming mandatory. They're forcing us basically.
They incentivize vaccinations.
I mean, listen, free food and $100, along with getting the vaccine. Who would want to turn that down? But in actuality, it kind of scared the community a bit. The urban community, as well as some of the Christian communities here in New York. So, I kind of said to myself, this looks a little funny. I don't know. I don't trust this. Because in my mind, I felt like, the government was never for us anyway. It was never for us. And so thankfully, our conversations have kind of like, it had me look at it in a new light, a different aspect. I did end up taking the vaccine for a job position, but I was opposed to it at first. And I feel like if it wasn't for our conversations and the job position that I was going for, I probably would have still been unvaccinated, but I did end up taking it.
And do you remember what was one of the biggest highlights or biggest points of information that impacted your decision to get vaccinated from our conversations?
So what I took from that was why fight something that was made just to help you? Like you asked me something so important. You asked me, so what is your biggest concern outside of the way the government handled administering the vaccine? And my only real problem with it was just how I was scared just about the way that they went about it. It wasn't about the vaccine itself. And so it caused me to think, well, if that's my only concern, then maybe, I kind of weighed, I did a weigh of the goods and the bads, and it seemed like, wasn't that many bads.
Awesome. Awesome. This has been a great conversation. We'll definitely get into more when we get into the panel discussion later on, but I just want to thank you for your willingness to come on here and share a little bit of your experience and share a little bit of our conversations. For those who are listening, those conversations weren't easy at times. We're smiling about it now, but we weren't really arguing about it, I wouldn't say, but we definitely, they definitely were intense at times because there were strong feelings on both sides. But at the same time, there was love on both sides because we needed to hear each other and we needed to be there for each other. And so I'm really happy that we had those conversations. They were very long, but I want to encourage everyone that's listening that it's worth it, you know, having long, hard conversations. And sometimes it didn't always seem, and I think you would agree, Emmanuel, that it always didn't seem like there was going to be a resolution. But we made it through, and it was impactful. And I couldn't always see it on my end. And I just want to let the audience know I didn't always see the effect of what I was saying, but it did have an impact. And that's why we're here today. And so I want to thank you. And with that, I'm going to turn it back over to Dr. Ulysses Burley, and we'll have our next speaker. Okay.
Thank you, Lewis. Thank you, Emmanuel. I want to welcome in now my CoVPN Faith Initiative faith consultant, Minister Tiauna Webb. Minister Tiauna Webb is the Director of Missions and Programs for the Samuel DeWitt Proctor Conference and a member of Trinity United Church of Christ here in Chicago, Illinois. Minister Webb, welcome.
Thank you. Thank you. Good to be here.
Yes, it's awesome to see you. So grateful for the ways in which you've partnered with me and the CoVPN Faith Initiative over this past year to help us further understand what was happening in our faith communities, but also what our faith communities needed, right? The Samuel DeWitt Proctor Conference has a huge footprint in not only the social justice space, but also in the faith space, particularly in Black churches. And I know you all early on were ahead of the curve in terms of making sure that your member churches had the access to the information that they needed from trusted messengers, right? It's important to add that trusted messengers part on because it matters from whom which the information comes from. And then throughout the pandemic, you all have been deploying various surveys to try and better gauge just how the pandemic was impacting your churches, how it was impacting faith leaders in particular, and the kinds of services and help that they needed to be able to be effective in their ministry. And so could you talk just a bit about your work with the Samuel DeWitt Proctor Conference and the work that you all have been doing, what that work has revealed as it relates to faith communities around COVID-19, the vaccines, and maybe even share a little bit about how COVID-19 has impacted your own personal life and your family, right? I have the tremendous pleasure of being friends with you and your husband, and you've got beautiful children. But I remember those conversations we were having throughout the pandemic about their exposure and whether or not you could see grandparents and things of that nature. So tell us about all of that.
Of course. And you know, maybe I'll end there because that's probably nearest and dearest to my heart, my family, my children. But I'm so thankful to be here. I'm so thankful to have been invited. This is a critical conversation. This is real. This is going on in our community. So I'm thankful to be a part of it. And like you mentioned, the Proctor Conference. So some of the work that we do and some of the work that I do with the Proctor Conference, we build the capacity of the Black church to serve, and in my view, to center and to be in solidarity with our siblings who As Howard Thurman says, their backs are against the wall. They're the siblings on the margin, the same gendered loving siblings, or the siblings who are labeled living with HIV, or our brothers and sisters who are living with addiction, or our refugee sisters and brothers, or our returning citizens, sisters and brothers. And we want to make space for them in our faith communities. And we want to ensure that we are amplifying their needs as much as we do our own. So at the Proctor Conference, we do our work understanding that poverty is violent for everybody, and gun violence is violent for everybody, and racism and Afrophobia touches every Black and brown body in this country in one way or another. And climate change matters to us all. And so those are some of the issues that my work centers around as a director of programs. And so at Proctor, we live at the intersections, and we are all about our shared fight for liberation. And that's the tradition upon which we stand and we do our work. And that's, I think, the strength of the work that we've been doing with COVID is standing on that tradition. We know that in times of uncertainty and times that invoke anxiety, a lot of us are looking for a word. I mean, we don't know what to do. And so, as you mentioned, the trusted voices in the Black community are the pastors and the clergy, are the faith leaders who are looking for a word, need a word to be able to provide their communities, especially during a global pandemic. So as you mentioned early on in 2020, Dr. Carruthers, our co-founder, who along with, we also have Dr. Jeremiah Wright, Jr. and Reverend Dr. Frederick Kings III, who is our co-founder. Dr. Carruthers really wanted to convene some of the most esteemed African-American health professionals, ethicists, educators, justice-minded clergy and lay leaders to serve as an African-American pluridisciplinary body to identify, assess, and make recommendations concerning the dynamic trends of COVID, and its particular impact on our communities. And Dr. Burley, we were so grateful that you joined that effort in the Bioethics Commission. And really the time was right, because as we've heard from some of these conversations, the political climate was terrible. I mean, there was so much disunity and misinformation. People didn't know who to trust. So this effort done by Dr. Carruthers early on was to give a clear and concise, trusted word. And so we distributed informational bulletins to our network, which touched over 8,000 people around this country, faith leaders, coast to coast, giving them information specifically on the first bioethics informational bulletin was on guidelines for reducing exposure to the coronavirus. We talked about which hand sanitizers to trust. We talked about how to safely wear a mask in one of the issues. In August of 2020, we had some information out about children returning to school. The schools were opening and COVID rates were still rising and people didn't know what to do. So what message was faith leaders going to have? And so the real benefit and the real interesting thing that I think the Bioethics Commission did was they gave the right questions for faith leaders to be asking. And so there's so much that we were learning as the Delta variant came, and it was hard to have absolutes. There were a few things we were sure of. There are a few ways that we were sure to keep our community safe, but there was a lot that we were still learning. So they were honest about that. They were upfront about the right questions to be asking. If your child was going back to school, you should be asking questions about the space. If people did want to come visit for holidays, you should be asking questions about who's at greatest risk for exposure. So there were things that the Bioethics Commission was able to communicate as a trusted messenger. And hopefully through those informational bulletins, we equipped faith leaders who on a Sunday morning had to have a word for communities living in the midst of a pandemic. So we're grateful for that effort. And so as you mentioned, we had also been doing surveys. And so what's been most interesting to me is that people usually are not interested in surveys. I mean, it's just another thing you have to do, but people want to talk. People want to talk, and they want to reflect on what this moment and what this season is meaning for them. And it's very traumatic. A lot of people are going through some serious mental issues, mental challenges now. Our pastors our clergy leaders, the disconnection from community, the funeral fatigue. I mean, we think that we're all impacted because we have deaths in our family, and of course we are, but also, can you imagine having to do funeral after funeral after funeral during this moment? So a lot of them are experiencing funeral fatigue, uncertainty, and the disconnection from community is impacting our pastors as well as our faith leaders. But we're knowing that the information that we shared and that we got from our Bioethics Commission was working because a lot of our churches are committed to staying safe and staying in a hybrid community, even after the main threat of COVID dissipates. So nearly 80% are going to stay hybrid or online. They are adhering to social distancing, they're using masking, the ones who have gone back. And so we also know that this moment is changing the culture of the church.
Right.
I mean, this is serious. People don't know how to do baby ceremonies anymore virtually. I mean, it's a totally different moment we're stepping into. So through these surveys, we're helping pastors and clergy kind of talk through and think through what this moment has been to them. And now we're kind of making this pivot to envisioning the new. So we're not so much mourning and being sad about the challenges and the culture change, but really inviting this moment as a moment for us to embrace the change and live into a more sustainable way of living, a little more healthy way, more holistic way. What the surveys also told us is that nearly over half of our network, they're excited, they're motivated. I mean, it's a lot of sadness, a lot of anger,
Right.
a lot of things going on, but also this is a moment for them. A lot of them have been pushed into technology who haven't had that opportunity before.
Right.
A lot of them have experienced new ways of doing service that they've never thought before was possible. A lot of them have experienced increased giving, even during this moment. So they're motivated, they're ready. And we're just trying to really lean into how do we not just go back after we feel like the threat of COVID has gone away, but how do we really lean into a safer way of living so that when the next pandemic comes, we're ready. And so for me personally, I am a mother, as you mentioned, and that has totally changed my entire world. I would have gotten the vaccine anyway. I would have, but my decision to get a vaccine was 100% for my babies. It wasn't a second thought. Anything that would have reduced their risk for exposure, I was down for. And so I think being a millennial parent in this moment has been really interesting. Me and my husband are still trying to navigate how to do the work we feel called to do when the world is changing so much. But we are still really committed to the future for our children in ways that we have not been before. I mean, we've been able to be a little, not reckless, but we've been able to kind of live into our call in a different way before the season of parenting. But now we are future oriented, future focused, really thinking about, okay, so what does this health concern mean for the future of our children? And so if there's a way that we might contribute to, lessening their burden, we're down for it. So that's just a little bit about where we've been, Proctor, and where I am at personally on this issue.
Yeah, I really appreciate you sharing all of that, and I appreciate the way in which you ended with encouragement about what the future holds and how a public health crisis has not only changed who we are, but it's changed how we worship, it's changed our church. And so I think that's a really great transition into bringing everybody back into the conversation to talk a bit more about how we continue to bridge this gap between public health, science, and faith. For me, faith and science are really more alike than they are different in the sense that both of them support the healing, both of them support wellness, Both of them are about life and life abundantly, right? Those are the core tenets of my faith, at least. And as also a researcher, I know that every time I go into a laboratory or a patient room, that it is to extend the life of the human race, and that sounds a lot like faith to me. And so, you know, when I hear this divide between faith and science on the basis of people's belief systems, I lament, because I understand the science to be something that is God-given, right? That was sent here to protect us from the things that emerge. And I've been encouraged by the shift that we've seen in some of our faith leaders who might have been hesitant to embrace more of a deeper role as faith communities in science and biomedicine and public health. And so I'm really hoping that we're entering into a new environment where we can begin to have these deeper conversations around HIV and AIDS, right? And all of the other health disparities that continue to persist and impact us, such that people don't say, God's got me and God's going to heal me, but that people will say, God gave me health insurance, or God gave me access to life-saving medicine, or God gave me a physician that I'm going to go and engage, because I understand that to be in line with my faith and my belief systems as well. So thank you so much to each and every one of our panelists. I invite you all to join us. Let me remove this spotlight from us. To join us into conversation. And we want to now open things up to the wonderful audience that has journeyed with us throughout this conversation. There's been some exciting dialogue happening in the chat, and we want to make sure that we can open things up so that there's a conversation with you all as well. And so let's see. We got one question. What is being done for pastors who are going through mental health challenges and are having difficulty trying to minister to their congregation who is dealing with mental health challenges? Okay. I'll begin by saying that one of the things that was most revealing to me from some of the survey results, Minister Webb, that you shared with me, was that overwhelmingly faith leaders were communicating challenges around the mental health of their membership, but also their own personal mental health. And to your point, I don't think that it's something that we considered early on. We always think of faith leaders as kind of all-encompassing helpmeets, right? They're not only our pastors, but they're our teachers, they're our counselors, our therapists, and a lot of times, sometimes pastors aren't equipped to be able to carry all of that. And so we have to think about then, how do we empower pastors to say, hey, this is out of the realm of my training and my call, but let me direct you to the properly trained persons and we can go and engage them together. But then to also be able to say, everything that you're carrying, you've now dropped it on me, and I might need help in carrying that as well. And so how then do I seek support for my own personal needs? And I can say that a part of the CoVPN Faith Initiative was not only to reach people with education and information regarding COVID-19, but it was also to help develop tools for faith leaders themselves to be able to use, not only to minister to others, but to minister to themselves. And it's work that will continue to be ongoing, work that we have crowdsourced through our faith consultants like Reverend Webb and others, in terms of how we not only produce materials for faith leaders to be able to minister to themselves, but also how we produce a new infrastructure within our faith communities that allows for faith leaders to take the time off that they need, whether it's sabbaticals or mental wellness breaks, without the stigma, right? As we're talking about stigma in this conference all week, without the stigma that has, for whatever reason, been associated with faith leaders caring for themselves and not just other people. I'm sure that there are things in place specifically that have been put forth to help address the mental health challenges of faith leaders. I know the Balm in Gilead, which is actually hosting their national conference today as well, has really taken a leap into the space of mental health wellness for faith communities and identifying trained experts who have experience in engaging churches and other faith spaces around mental health challenges. But I think there's also something to be said about the ways in which we contextualize sacred texts, sacred scripture around these issues of mental health challenges to destigmatize the conversation and to further liberate people to be able to have those conversations more openly. And I'm open to hearing from our actual resident ministers and reverends on any feedback that you all might have about the ways in which you've tried to maintain your own mental wellness. Reverend Red, do you have any feedback on ways in which you try to care for yourself in the midst of trying to minister for others?
So for me, I just like my personal thing is I've said no more in the last 18 months than I ever have, because I understand like my limitations now when I'm being pulled too much, when I'm being stretched too far. And I know what it does, not just only to myself, but also what it does to my household. Like I can't enjoy my children when I'm like stressed, when I'm like stretched too thin. And so like I have to find ways to be able to tell people like I can't do that. No, I'm unable to go there. I'm unable to be present. I've been in the yard more in my house over the last 18 months than I ever have, and I'm enjoying that. I'm enjoying blowing leaves and planting grass and all these other things, just nature. But also, I'm retreating. I've retreated twice. I'll retreat again in December. And I wanted to share, there is a program called Thriving in Ministry that is being hosted by Dr. Nathaniel West and Dr. Jessica Young Brown out of Virginia Union, and for pastors who are seeking breaks and retreat and getaways. And I would suggest that retreat is one way for people to be able to find themselves again whenever they feel like their mental health is in a race. So you can email them. I'll drop the email in the chat, but it's thrivinginministry@vuu.edu. And so I'll be retreating in December through Thriving in Ministry. And I think, that might be one way people can help deal with some of their stressors as well.
Thank you for that. That sounds like an excellent resource.
I just wanted to take some time to speak to our friend Emmanuel. and just get his perspective, as a layperson in the faith community. What was your perspective on mental health during the pandemic, especially in a place like New York, where I know at one point it was the epicenter of the COVID-19 pandemic. So you want to give us a little insight on, how you saw mental health during the height of the pandemic, and, how you coped, or how you saw other people in your church community coping.
Whew. During that time, during the pandemic, it was a lot. It was a lot going on. For a time, it was very quiet. People stayed to themselves and the comfort in their homes. But then after that season, here in New York, things got a little out of control. I guess because of everything that was going on, the scare of COVID, the uncertainties of the government and all, because they were still trying to restrict us at the time, and people didn't know how to deal with all the restrictions. So a lot of times, people were acting out. But thank goodness and thank God for the faith that I was brought up in. I feel like we held it together. A lot of times I was a little unsure. I felt a little doubt at times, but because of my faith, I feel like it held me together. It held me down. So yeah, I mean, I'm pretty sure y'all all heard about the riots and things that were happening in New York during that time. But I can gladly say, for the most part, the people of God, we held it down. We held it together. We kept the faith even though we were afraid. Well, I can honestly say I was afraid, but we still held it down.
Thank you.
I just quickly share that another one of the Proctor Conference Network, Reverend Mark Thompson, so he also lives in New York, and he was seeing the trucks carrying away bodies of people. And so out of his fear that he would not survive the pandemic, he and Dr. Carruthers and Reverend Jerry Wright, they started the Samuel Dewitt Proctor Conference National Service of Daily Prayer and Song, which we do now every Friday. There's a prayer, there's song, there's a time of worship and fellowship in the midst of everything. A lot of pastors, clergy can jump on and just plug in and worship. And it's a great way to end the week. And we also have at our annual conference, we also do have workshops on mental health, self-care, care for the pastor. So I encourage you to explore our website or our Facebook page for more information. We definitely are concerned and have resources pointing pastors and ministers and clergy in the right direction towards mental health and wellness.
Minister Webb, I invite you to put your website in the chat for
Great. Sure.
all our guests, so they can access those resources.
So Ulysses, I have a question for our panel. As we are out doing this work in faith communities, we hear so many things come up in the communities concerning vaccines and the COVID-19. There's so much, as we know, there's so much misinformation, but it's particularly can be difficult when it gets mixed into faith and certain, faith tenets or just faith beliefs. So I was just curious, for those who have been going out and doing educational activities in faith communities, what kind of things what are some of the common things that you've been hearing, maybe particularly related to faith, in terms of misinformation with COVID-19, and how do you address it? If anybody wants to share, I know that's a big question.
I can start as a faith ambassador for the CoVPN Faith Initiative. I think we have to start with care, right? And so there are a lot of people who possess the information, the correct information necessary to allow people to make an informed decision about their health as it relates to COVID-19. But there's a care for which, especially during these tough times, for which people need that information shared and disseminated. And so for me, it was reading the room, if you will, understanding context. Cultural competency was very important, which is why the CoVPN Faith Initiative, the HVTN Expanded Faith Initiative have been very intentional about recruiting ambassadors who reflect those communities that are most at risk, which tend to be communities of color, because we understand culture intersects with public health, intersects with faith and our belief systems. And so there was a lot of perception that was involved in terms of engaging people around their information, or more specifically their misinformation, and then care that needed to be involved with how you delivered it. And sometimes that meant being willing to endure rhetoric, if you will, that was hard to digest or swallow, such that you can get to a point to where you could say, well, based on my training, I just know that not to be true. But here's why it's not true. And I can see why you might believe that. And your skepticism is very valid, especially given, the legacy of medical abuse against people of color in this country, right? So you have to acknowledge people's fears. You have to acknowledge their skepticism, understand where the conspiracy theories manifest from, but then with care, unpack those things to say, I can tell you without a reasonable doubt that this is the truth based on what we know right now, right? Because that's an important caveat, right? Because COVID has been a quickly changing epidemic. And so what we know today could be completely different from tomorrow. And sometimes people latch on to that as us communicating lies or misinformation. Well, it wasn't a lie yesterday. It was just we got more information, we got more data today to be able to update you on that. And so there's a level of care that comes with the information sharing. There's a level of grace that needs to go around for both sides. And there's a lot of listening that has to take place. And so, people see me in this capacity, usually speaking, but I've done far more listening than I have speaking over the last 18 months as it relates to the pandemic, such that I can know how to best reach the people who have yet and still been plagued by misinformation and false narratives and fake news.
Great. You're getting a lot of positive feedback in the comments, Ulysses. It's great.
That's good to hear. That's good to hear. Any other questions from our audience? We want to make sure that we give you all the space to be heard as well. And maybe we did a great job and you don't have any questions and you're satisfied with what you've heard. That's okay too. Lewis, maybe we can give, oh, here we go. Were you also able to encourage religious leaders into changing their perspective if they were reluctant to direct people to get vaccinated, or did you mainly focus on the communities? That's an excellent question. I can say that we understand there to be power from the pulpit, or whatever your platform might be. And one of the reasons why we enlisted faith consultants like Reverend Webb was that so that we could leverage that power and that trust that we understood faith leaders to have. I think it's important to note that everyone who we partnered with didn't come into this work fully trusting, fully accepting of the science that was being proposed for COVID-19. I think that's important to note. But they were willing to hear what we knew. And so people were clear at the very beginning to say, hey, look, if you're asking me to endorse a vaccine at this point, then you can count me out. And that was valid. Those were valid reservations, right? And so even the people who we engaged early on to connect us to their communities, to be able to share information, weren't necessarily people who were fully bought into anything government related, right? Which this program has been largely supported by. And subsequently anything related to the vaccines or Operation Warp Speed, which we can, all agree that maybe was poorly named at the time. But they were willing to listen to what we did know. And eventually when we had enough information, when we had the data, when millions of people had safely received the vaccine, those faith leaders started to come around and themselves would encourage folks to go and be vaccinated themselves. Obviously, it's not a one size fits all. There are still faith leaders in this country who are vehemently against vaccination. Many of them have died over the last year and a half of COVID-19. Not to be crass, but it's a true statement. Every day you log onto the internet and you see a story about a faith leader who was publicly against COVID-19 vaccination, either being hospitalized with severe COVID illness or passing away. And it's unfortunate, but we've seen more change hearts than not. And I think that is a good sign of the future and hopefully a positive sign for our work around HIV and AIDS. We understand that HIV and COVID-19 are not the same. We know that with HIV, we are contending with a 40-year history of stigma. We know that we are contending with the intersection of identity and sex and sexuality as it relates to faith and people's belief systems. But yet still, we're encouraged that we can leverage this moment and people's willingness to hear, to learn, to shift, to be able to get people to do the same as it relates to HIV and AIDS. And ultimately, as it relates to stigma related to HIV and AIDS, I always say that at this point in time, people don't die from HIV, people die from HIV-related stigma. If we were to cure HIV tomorrow, stigma associated with the vulnerable populations that are disproportionately impacted by HIV would still exist, and that stigma would still impact people. And so this work is very important, not just for the sharing of biomedical information, but also the sharing of stories, because while information informs, stories transform.
Awesome.
And Ulysses, you said it earlier about the skepticism that was, I guess I don't know if you said it was welcomed, but also the conversations that you had to navigate through. I even maintain, like, even after our conversation, even after getting the vaccine, like there is still, I wouldn't necessarily say like every single day I wake up saying, hey, I'm like 100% on board. I think Emmanuel even said it, there's always a sense of like, uncertainty that remains there, that I feel like it would never go away, no matter how much information I have on either side, whether it's good information or bad information. you know, and not, like now I'm in this space, you know, I got a 7-year-old daughter.
Yeah.
And so now I got to make this decision for her, you know, my wife and I. And so, you know, which I feel like is tougher because I made the decision for myself, you know, like, you know, she's 7, like, you know, I gotta, like, you know, I have to make the decision for her. We have to determine, you know, what is safe for her now or not. And so we're still in that space of like, are we gonna do this? You know, even after being vaccinated ourselves.
Yeah, I think that's an important tension that you lift up.
Mm-hmm.
Because we are in a space now, right, where people have to make decisions about boosters. People have to make decisions now about their kids. And while we might have enough information for me to have made a decision about getting the vaccine personally as an adult, what does the information say about you know, our children, our babies? And so a lot of our work over the last month or so has been addressing those questions, right? It's kind of almost like we're starting over in a sense, because parents need to hear enough information to get their children vaccinated, just like you. And while they understood them doing so was both protecting them and their kids, it's different, right? And so we just have to continue to be able to have these conversations for people to be vulnerable and for folks to have grace and to handhold people throughout the process, right? We need each other, and I really appreciate you sharing that.
But the difficult piece to that end for me is having white colleagues who have like no apprehension whatsoever, you know, about it, because the history does not, you know,
I got you.
like the history is not the same. And so you see, you know, when you're on Facebook or social media, you know, like the 5-year-old is vaccinated first day they approved it, you know, like, and they're, you know, they're proud about it. And so, you know, that same, you know, they don't necessarily have those, you know, same, you know, skepticisms that we do.
Yeah, you raise an important point about that intersection of race and culture and history, right? And those are all of the things that we've had to contend with over the last year doing intentional outreach to Black, Latinx, and Native and Indigenous peoples. I've had full talks where I didn't talk about COVID-19 at all. I just talked about the history of medical mistrust, right, in people of color, and how that has impacted the ways in which we make decisions today, right? And so it's an important message. I mean, we know that Black people in this country lack access to affordable healthcare. But even when we do have access to the affordable healthcare, we're less likely to access the healthcare because of the bias that we experience in healthcare facilities. And so we all have to contend with that when we think about going to get a vaccine at a healthcare facility where I've maybe been abused or experienced trauma before in the past. And so that's why it's important for us to do this work at the intersection of faith and public health. Because what would it look like if we could go to our churches where we very much so trust and feel love? Not to say that people have not been abused or experienced trauma in churches or faith spaces either. But for those of us who consider our faith spaces and our houses of worship to be more intimate settings than that of healthcare facilities, what would it look like for us to be able to go and access our basic healthcare needs in those settings without having to process all of that historical trauma, abuse, and otherwise that participates in our skepticism? And so it's a question that we'll continue to try and answer through our work with the expanded HIV Vaccine Trials Network, and as we continue to address the current COVID-19 pandemic that lives with us as well.
May I add something?
You absolutely can.
So what I was thinking of, because I believe it was something that you said much earlier when you were talking about how people of faith they rely more on God to heal them than the vaccine itself. They rely more on faith than science. And I love what you said before, in reference how faith and science can kind of like work hand in hand. I know a lot of times people use like faith terms to kind of shy away from science, but I thought about something. When you're trying to reach people of faith and trying to get them to see the good in science, why not, instead of use faith to shy away from it, saying, well, I know God is going to heal me, I don't need to take this. Why not, say, if we walk by faith, if we have the faith in God, why not trust in science? If the vaccine was placed here to help us, to benefit us, why not pray over this thing and take it in faith? I know that's part of what Lewis and I have discussed, because that's what he brought to my attention. It's like, because it seems like you're fighting me. Why not, believe that God is going to protect you even within taking this vaccine? Why don't you pray over it before you take it? So that was just my thing, because I know someone had asked the question, well, how do you reach people in faith who oppose the vaccine? And I guess that would be my answer to it. It is no different than witnessing to an unbeliever. When you use yourself as an example, if we've taken the vaccine and, we appear to be fine and we're also Christian, I feel like that's the fastest way to reach someone, because sometimes you can give someone all the information in the world, just like how you're witnessing to someone. You can tell them about scripture after scripture and how God is good, but sometimes people, they just need someone to relate to. And by you being Christian and you showing them how you're still in good health and you're doing fine and your faith is still strong, it can possibly sway them to make the same decisions. And that's all.
I think that's enough. I think that's a beautiful way to close out a dynamic discussion that we've had. I want to give Minister Webb and Reverend Red to offer any final thoughts if they might have them. And then I'm going to turn it over to my colleague Lewis to close us out.
Definitely, I appreciate this opportunity again. I think this has been a beautiful illustration of what's needed. And thinking about that question that was just brought up again, what can we do to reach those who don't want to be vaccinated, is I think we can humanize their concerns and humanize them. I don't think, and I think that has been kind of illustrated here, how we do that, how we listen to one another. Dr. Burley, you've been saying grace, offer grace, offer grace, and that's something we all can do. And when we make space for people to be real about where they are, we can join them in the process of discerning what works for them. We can pray with them, like the brother mentioned, praying over this issue. So I think there are things that we can do, and I'm glad that this panel illustrated the most important thing is just being human with them and humanizing their concerns. Good to be here.
Thank you. What Minister Webb and Emmanuel just said was, so great that I won't add to it.
Thank you.
Yes, thank you all for, again, a wonderful dynamic panel. This has been a great conversation and just a refreshing time, I can say, for me. Not having the opportunity to be in these spaces and have these sort of conversations, I really appreciate it. And so I want to also just say thank you to everyone who took the time to join us today. We really appreciate it. There's so many things going on in the world, so many things that you could be doing right now, and you took some time out of your busy day to spend with us talking about, the intersection of faith communities and science, and we really appreciate it. And so just wanted to lift up all our speakers. We place all our information in the chat. So please, if you want to reach out to us, if you want to become involved, there was a lot of conversation in the chat about how to get involved and people really interested in this topic. So my information is there, Ulysses, his information and all, and the rest of our panel put our information there. So please feel free to reach out to us. And if you want to learn more about the CoVPN, you can go to preventcovid.org. That's where we have our CoVPN website, and you can learn more about the research that we do in HIV and COVID-19 vaccines. Also, if you're interested in learning more about HIV vaccines, one of the topics that came up in the chat was, you know, we have a COVID-19 vaccine, why don't we have an HIV vaccine? Which is a very common question that we get. So the quick answer is that HIV is a very different virus from COVID-19, but we are working diligently to develop an HIV vaccine. And if you want to know more about the work we're doing in developing an HIV vaccine, please visit HVTN or HIV Vaccine Trials Network.org. You can find out more about not just the community work we do in HIV vaccine research, but also the actual science of vaccines as well. And so with that, I just want to say thank you one last time for everyone who joined us. Thank you for our wonderful panel. Thank you to the USA Faith Coalition for hosting this space. And thank you, of course, to the International Conference on Stigma hosted by Howard University for creating this wonderful conference where we can come together and, you know, exchange ideas and encourage one another. So with that, I want to say, take care and have a wonderful day.
Thank you, Louis. We invite you all back to this space this afternoon for our second session for this Faith Day, which will address faith and trauma and healing. That will be at 3:00 p.m. Eastern Time, 2:00 Central Time. And so please come back and join us for another compelling conversation. And then finally, we want to make sure that we send out thanks to Reverend Michael Schunemeyer, who has been behind the scenes in facilitating this dynamic conversation and answering all of your questions and making sure that we had everything that we needed to be successful this morning. And so we want to thank him as well. Take care, everybody. Be on the lookout for future programming from the United States HIV and AIDS Faith Coalition. And we hope to see you back again this afternoon for our second session.